Hi, I'm here to talk to you today about GnuPharma's weight and weight loss ideas. Well, let's start very simply. How do our weight, of course, is a function of regulation and body regulation. Well, let's start with the big picture here and how do our bodies regulate? And I think if you ask most researchers or scientists, you'll get kind of a blank look. In fact, if you look at the middle of the slide, you'll see something called internal milieu nutrient sensing, which who knows what that means. So most scientists or researchers really don't understand how your body regulates, and they certainly don't understand these mechanisms. They may very well understand within a particular organ system, but not the body as a whole. So let's take you back to the 1990s. And in the 1990s, a brand new medical system was discovered. No joke. And I know that's hard to believe in our day and age, but this medical system was unknown up until the 90s. And it turns out that it's very, very, very important. And since about 1995, it's been heavily studied by pharma. And further, this system really appears to be the regulation, overall body regulator, but it certainly is responsible for regulation within organ systems and neurology, and it appears to be the overall body regulator. Well, what has pharma done with this wonderful information and all of this research? They've developed a few drugs, none of which have made it to market, but certainly they developed a drug called Renambit. Renambit went after kind of the main neurotransmitter in this system, and they developed Renambit really for a weight loss drug. It was thought that this system certainly regulated eating, feeding, and craving behavior, and that by blocking a particular neurotransmitter in the system, which is what Renambit does, that would cause the subject to lose weight. So this went through mouse and rat trials and it worked really well, and they decided to ramp it up to clinical trials. Renambit showed great promise for weight loss. It worked very, very well. Regrettably, it also caused extreme depression, and they had some suicides in the trials, so they had to discontinue the trials. Still very important to know, though, that certainly that target showed great therapeutic, interest for weight loss, but also for mood. And although it went the wrong way, that's fascinating. And you can certainly read more about the Renambit clinical trials in the Journal of American Medical Association, or JAMA, and there's a link there that you can reference. All right, so why do we not have more products from pharma? Well, it's really easy. I mean, most of these, the main reason is they can't make money on it, right? So most of these things require multiple influencers, and because they require multiple influencers, that really doesn't fit into pharma's model. They want a single influencer that they can synthesize and patent. So what is this marvelous new medical system? It's actually something called your endocannabinoid system, and we refer to it as the ECS. Again, don't let the word endocannabinoid scare you. Similar to an internal system that you have called your endorphin system that most of us have heard about, your endorphin system was named after morphine because that was a drug that was used to discover it, and then it lit it up, and so it was used to study it. Similarly, your endocannabinoid system has been discovered by cannabis, and cannabis has been used really to light the system up and help map it out. Up until really the mid-2000s, it was assumed that this internal system that we have, our endocannabinoid system, could really only be influenced externally by cannabis, but we know better now. All right, so let's take you to GnuPharma, and really GnuPharma's founder, Chip Paul. So Chip Paul, he's an entrepreneur, he's a researcher, he's an inventor. And really this discovery and everything ECS here came about because Paul was deeply interested in medical marijuana and its benefits medically. And in 2014, or actually 2013, Paul and his wife founded an organization called Oklahomans for Health. Oklahomans for Health is really the petitioning body across the state of Oklahoma for the medical marijuana question. Well, Paul, as founder and spokesman for the organization, felt like he really needed to have all the answers for medical marijuana. Certainly, if he was going to be interviewed on TV, he would need those answers. And so he began to delve in and research this new system. But interestingly enough, he quickly found that while certainly medical marijuana is valuable, the true value of medical marijuana is just the way that it influences this internal system called the endocannabinoid system. All right, so what exactly did Paul discover? Well, he discovered that there was a lot of data, first of all, about this system, and certainly feel free to satisfy yourself. There's tons and tons and tons of research on the endocannabinoid system. But further, he discovered that this system is very, very old and very, very ancient. We all know what our central nervous system is and how important it is to our function. It turns out that the endocannabinoid system, or ECS, is equally as important, if not more important. In fact, we share a common ancestor for these two systems, something called the hydra, which is very simple and basic. And if you know much about sort of zoology, that indicates this is a very important system. But there's other reasons why basically, Paul felt and GnuPharma now feels that the ECS sits above the central nervous system and really manages the central nervous system. And that detail is certainly easy to ferret out of the company. All right, so what does Paul's model or the GnuPharma model of the ECS look like? Well, we certainly understand something like our vehicle, and we understand that our vehicle has a computer system, and that computer system is constantly monitoring things like oil pressure and engine temperature and fuel level and oil level and tire pressure and whether it's raining or not, and depending on the sophistication of your car, just a myriad of things. Well, in a very similar way, Paul's model of the ECS captures the same thing. So in this model, Paul believes that really the brain, and in particular the hypothalamus, is the main human computer, and that by the hypothalamus and through the endocannabinoid system, the hypothalamus is able to monitor the entire human condition really down to cellular level. And this is done really by the ECS through glucosteroids and a variety of things. But the hypothalamus, again, is constantly monitoring the CNS, is constantly monitoring organs, is constantly monitoring the human body down to the cellular level, and takes actions based on cellular need, injury, all different kinds of things. But basically, the endocannabinoid system is the mechanism of action inside the human body, and it's managed and governed by the hypothalamus, and in some cases, the hippocampus. So, is this system influenceable? Well, it certainly is influenceable by medical cannabis, and that's proved again and again. But something that Paul did, and mainly because of the location of the company being in Oklahoma, cannabis was not a viable alternative to test this model. So Paul had to come up with something else. So he built a system of herbal and spice-based influencers. And he basically started from known research, and you can read about sort of what is known there at the British Pharmacological Society of these plant-based flavonoids and how they affect the endocannabinoid system. But GnuPharma's taxonomy here now is vast and broad, and there's many, many influencers of the ECS in the plant world. So how does this apply to weight? It applies to weight because the model of the ECS is both descriptive and predictive. And there's a very interesting thing that overweight people have that most normal people don't have, and it's a regulation issue that's pretty easy to identify. So, what are these differences? Well, guess what? People who are overweight have way too many endocannabinoid resources. Now, the way these things work in feeding and craving is that generally in your hypothalamus, your ECS resource level will increase. And as it increases, this causes hunger. As you eat and as the nutrients are sort of identified and mapped out as they move through your gut, your ECS resources diminish in your hypothalamus, and this is what creates a fullness or satiety. And this is very determined by research, and a very hard research here. But the difference between really overweight and normal people is that overweight folks appear to have way too many ECS resources. So what happens is they always are in a state of hunger in their brain. Further, it appears the way that they sort of break down the precursors to create these resources is somewhat broken. So what does this result in? Here's the interesting thing, I think, that I believe people who have weight issues really need to know is that your body, through your brain, screams at you that you are hungry all the time. And no amount of willpower, no amount of exercise, no amount of anything can overcome really your brain telling you that you need to eat. So I think that's a very important thing, is that this isn't a willpower thing in the least. It's a physical difference that is honestly easy to fix with supplementation. All right, so we would like to make an offer, really. We want to prove that our formulations work for weight loss and that we're on the right track here. And in order to do that, we need to basically have a sample pool and try it out on folks. Now, all of our formulations are made with very simple and benign herbs, and our weight formulation is no different, and they're very clearly identified on every single bottle. And so when we make this offer, we're not shipping you something in a bag. It's bottled and properly handled and all of that. But we would very much appreciate your feedback on this product. So our offer again is that we will, and you can just navigate to our website. We're going to have this weight product really just up there for shipping and handling charges. So you would pay $12.95 and get a bottle of the product. If you take all, and you'll get instructions on how to use it, but if you take all of the product, you will either know it's going to work for you or not. And we'll give you a coupon if you sort of take a survey to get the next bottle at the same price. So we want to make sure that really anybody who gets started on this product has the ability to sort of follow up. We want to give you a good deal, but we certainly want data, and we want to find out if this product is really working the way that we think that it's going to work. So with that in mind, we will conclude this presentation. We hope that you go to our website and certainly sign up for the trial, get a bottle, and try it out. Thank you very much, and I hope you have a wonderful day.